Hi, I'm Eleanor Rivera, and I'm going to talk to you today about my recent study that completed, mostly complete, a little bit of COVID delays, so still some analysis to go, but still excited to share these results with you. So this is characterizing illness perception phenotypes in older adults with chronic kidney disease. And so an obvious question that comes from that is, what is illness perceptions? So this comes from a theory by Howard Leventhal, who's a psychologist, is at Rutgers. And it's this idea that every person who's diagnosed with an illness understands it in a different way based on their lived experience. And so what are we talking about here? So these are things like, do they think of this as an acute or a chronic illness? Do they think that it has any kind of pattern, or it changes a lot from day to day? Do they think they have any control over it, or that their treatment does? Does this illness have any consequences on their life? And do those consequences give them any sort of negative emotions like anger or fear? Do they even feel like they understand what the illness is or how it works? And what do they think are symptoms that they experience that are associated with it, and what could have caused it? So all of these things smushed together to give you sort of an overall perception of how an individual understands their illness. And a lot of the times when we're talking about this in particular, we're thinking about chronic conditions that someone's lived with for a while. And so what happens then is that these illness perceptions have an impact on coping and self-management behaviors. And over time, the individual assesses the impact of those coping and self-management behaviors on the illness in a sort of appraisal that re-evaluate what they think about their illness based on the success or failures or impact of these coping and self-management behaviors. And then there's also external stimuli that can come in, such as acute health events, or having people in their lives who are going through some of these same experiences that they've seen, or even things they've read, or conversations that they've had with peers or healthcare providers. So why do we care about these illness perceptions? Well, they capture a patient's lived experience with regards to the illness. They capture it efficiently, so we're able to assess this with formalized instruments, and it captures it holistically, looking at these different dimensions of the illness perception as well. And so we know that the illness perceptions are associated with many factors. So I talked about these coping and self-management behaviors, including treatment adherence, and then other factors like function and mood and self-efficacy. And to date, these instruments measuring illness perceptions have been tested in many chronic disease populations. So my prior study, which is actually for my dissertation, I looked at a group of chronic kidney disease, heart failure, and COPD patients, older adults living with these chronic conditions. And I wanted to assess their illness perceptions, and I used a latent profile analysis method. So what this did is, rather than thinking of these elements of the illness perception separately, I combined them together and created these overall profiles. And so you can see here the sort of model of how the study would go. And so I would be able to assess whether these different groups identified by the latent profile analysis differed both in the chronic condition as well as these outcomes of patient activation and acute hospital use, and then also able to assess other factors related to patient demographics. So what did I find? So in that prior study, I identified 3 phenotypes. So the first one I called stable. So these are people who are experiencing few consequences or complications related to illness. The pattern is overall stable. They've been living with it for a little bit longer and having fewer of these hospitalizations. Overwhelmed group, very different, but also sort of a predictable potential group you would imagine. So these are people who are experiencing many consequences and complications. Things were not going well for them, lower patient activation, more hospitalizations. But interestingly, identified this confident group. So this is a group of people who had very high perceived control over the illness, felt like they understood it and what was going on. They had high patient activation, but they were being hospitalized at the same rate as that overwhelmed group. And I was so excited when I found this picture that I think illustrates this really well, where people, think that things are going well, but have, not this necessarily understanding of the dangers that they might be facing related to the illness. So that's my previous study. And then also just to point out that they didn't see any differences significantly between the groups in terms of gender, those chronic conditions, or age. And I didn't see difference in race, but the sample was about 75% Black, and so didn't have really enough variability within the sample to assess that. And if you're interested in learning more about that study, I have the reference listed there on the bottom. So then what's next? So what I wanted to investigate is, okay, how stable are these subgroups that I've identified, and will I find them again in a new sample? And then what's driving these subgroup differences, right? We can have a lot of theories about what's really characterizing, especially this confident group and their sort of mismatch between their perception and the reality of how their illness is going. And so for that, I really felt like I needed to focus in on one chronic condition so that I could use disease-specific measures and variables. And then, as this picture illustrates, cast a wide net, be able to assess a lot of different potential factors that could be having an impact on these subgroups. And so when I was deciding what to focus in on, that's when I really started to turn my efforts towards chronic kidney disease. There's a lot of characteristics about it that I think is really important for investigation. So this is a growing epidemic, especially in older adults, often happens as a consequence of a life with diabetes or hypertension, as there's sort of accumulation of kidney injury over time related to those chronic conditions. We know that there's disparities in outcomes. So if you look at that reference below, I worked on a paper with colleagues that was published recently that was sort of an overview of disparities in chronic kidney disease. And we do see differences in patients' progression to that end-stage renal disease. That's those people who are living on dialysis and have a really big impact on their life, quality of life, mortality, all these other outcomes. But what's nice about chronic kidney disease, and that's what I'm kind of hinting at with this third bullet, is that, an individual with chronic kidney disease who hasn't progressed to that end-stage renal disease point really may not be having a huge impact on their life from the chronic condition. But then when people cross over into that renal failure point, it has a very big impact on their life. And so we do have the ability to keep patients in that earlier stage and really have a great impact on their life, their health, and other related healthcare outcomes. The rate of progression that individuals experience and the lived experiences that patients have of their chronic kidney disease can vary widely. And that's why I think these patients' perceptions of illness can be really critical in chronic kidney disease. So what did I do in this new study? So I was able to pair up with a nationwide longitudinal chronic kidney disease cohort study that's been going on for more than 15 years. And so I had a site at the University of Pennsylvania, which is where I was as a postdoc at the time, and then another site at Case Western to give us some variability in our sample. So these are all patients with this, like I said, that earlier stage chronic kidney disease. So none of these patients that are experiencing dialysis. The cutoff for CRIC participation is older than 45, although the patient sample is a little bit older than that on average. And then the one thing I will say, and I'll talk about this a little bit later when we're looking at some of the results, but these are people who have been participating in this cohort study for kind of a long time. And so it's not necessarily the most representative sample. So my data is collected in 2019 into 2020. So I hinted at some COVID delays back at the top. So I have about half of my sample was collected before the pandemic, and about half of the sample was collected after the pandemic started, starting in about, I want to say it was like May, once research got up and running again after that sort of initial pause I know a lot of us experienced. So far, none of my analysis have been impacted by when the data was collected, either before COVID or during COVID. Just to let you know, I haven't seen any impact on that so far when I've been controlling for it in my study. So what are some of the new variables that I'm looking at? Looking at personality type, so optimism and pessimism, to see if that's having an impact on that confident group. Chronic kidney disease knowledge, as well as getting into some adherence variables, including medication adherence. And so the first thing that I want to pull your attention to is just the difference in the composition of the groups. And this is, I think, related to what I just mentioned about this not being the most representative sample, this cohort group. So in my original study, I saw a relatively even distribution of the groups, with actually the most patients being in that overwhelmed group. Whereas in this sample, a lot more of those patients are in that stable group. So it's actually more than half of the sample is in that group. So it's definitely a very different, different thing going on there overall. So I did see a difference based on that personality type, but I actually found that it's the overwhelmed group that's being marked by a more pessimistic outlook compared to the stable and confident groups. Didn't see any significant differences in chronic kidney disease knowledge. So that's kind of like a skills-based sort of quiz about chronic kidney disease. No differences in medication adherence, although this is a very highly adherent sample overall, so that may be getting in the way there of that. And didn't see any significant differences in GFR, so that's one of those outcomes that we look at when we're measuring chronic kidney disease severity. We do see a difference in sort of perceived health. So we identify here that the overwhelmed group has a lower perception of their overall health compared to that confident group, which is a little bit higher, the stable group a little bit higher. This scale is inverted, which is why I'm saying those words backwards to what the numbers are, but lower score is a better perceived health. I did see differences in demographic groups, which is different from what I identified in my original study. So I do see differences in age. So that confident group is the youngest overall compared to that stable and overwhelmed group. So that is an interesting factor that could be going on related to maybe accumulation of experience relative to the other two groups. I do see differences in race. So that overwhelmed group and the confident group are more likely to have participants who are non-white compared to the stable group, which was more likely to have participants who were white. And then I didn't see any differences in gender for those groups. So what am I going to work on next? So this is just the quantitative analysis portion of the study that I conducted. So a couple of different ways I'm going to be moving forward. So looking at a clustering methods approach. So I had just sort of that one approach that I used to look at the clustering groups within the sample. So I'm going to be working with my statistician to identify if we're using the best strategy for the clustering methods and to assess that sort of overall phenotype stability. Complete this analysis that I'm doing with the quantitative data. I have some more adherence variables and other longitudinal data that I'm still working on and analyzing now. And then I also collected qualitative data for this study that I am in the middle of analyzing with a colleague. So definitely more things to come just from this study. And then I also submitted a K23 last month for a pilot clinical intervention that's going to be using this illness perceptions data in a chronic kidney disease population. So thanks so much for listening to my talk. If you want to reach out, I'm always available at this email address, and just having some funding acknowledgements below, including obviously funding from the RCMAR. So thank you so much.